Hello everyone, welcome to Beverly Hills Hilton. We're here today. I want to introduce you to my wonderful brother here, Miss Dr. Raymond King. And to my left, my right-hand person, Miss Bonzzie.
Hello,
Williams.
happy Sunday.
Happy Sunday. We're here today because we would like to ask him some question about immunity. I have made the video on immunity, but he is a real doctor. So tell us a little bit about what do you think about the immunity? What is the best way we can combat this crazy virus that have made us as a total halt of the whole total society? We are like, stop, second lockdown in California.
Wow. Well, that's a very complex question, but I can tell you that generally the immune system is something that we all have, and there are many things that you can do to maximize the function of the immune system. And it's known that your immune system can vary from day to day based on many different factors.
Exactly.
And in an era a time where we are in a pandemic where our immune system is under constant attack, you always want to do whatever you can to try to maximize your immunity.
So what do you think, what do you recommend see, the problem is the common Americans, they want, give me the vaccination, give me the medication, give me this, but don't tell me not to eat fast food, and don't tell me to eat normal food. I can eat whatever, but give me the pills. Mm-hmm. So that's why we have around 75% Americans. I'm one of the rare women who has never taken antibiotics in my entire life because my lifestyle allows me to do what I'm doing. So please talk to them and tell them what they can do to keep up with their immune system.
Wow. Well, so there are many things you can do. First, perhaps I should start by talking about things that can depress the immune system so that I can give you an idea about things to avoid.
Great.
Yeah. That's a good analogy, by the way.
That's great. Yes.
Avoiding stress.
We're listening.
Avoiding fear.
Yes.
Maximizing your oxygen. Getting exercise, getting nutrition. Sleep is very, very important. What is interesting is some of the things that we are being advised to do, all it does is maximize fear, maximize stress, decreases your oxygen.
Yes.
That's right.
If you put a heavy mask on somebody and force them to rebreathe their own carbon dioxide, many times too, on the nutritional side, people are poisoning their systems, eating the wrong foods or eating junk foods, things that all of these things can compromise your immune system. And especially in a time when you need your immune system to be boosted.
Yes.
I think faith is also good, right?
Oh, absolutely. Absolutely.
Tell us a little bit about the story about Texas you were talking about. COVID.
Well, what's interesting is, I'm visiting here from Texas, and in Texas, we, at least in the public spaces, they are not as restrictive as they are here in California. And it's very interesting because on 2 occasions in my 24 hours that I've been in town, I've seen instances where people are berating or yelling at other people to put their mask on, even in an open public space.
Oh my God.
Where there is no scientific medical way that, that a virus could cross the street. I've made an analogy to religion in that if you have faith in God, God is a being that you cannot see, that exists, and you have faith that he exists. And what's interesting is COVID has been adopted by some people as this omnipresent being.
Yes.
And COVID has become like a religion where the followers of this religion have become zealots and have resorted to
Yes.
judging and berating others who aren't showing the sign of that religion,
Wow.
wearing your mask.
Respect. You're not
And-
respecting the God of COVID, right?
And
Oh my gosh.
and it dawned on me that perhaps these are people that did not have a strong faith in a God, or were looking for something to believe in, and now they found COVID and have found a haven for them. They found their religion.
Wow.
And
Well, it's just like when I was mentioning earlier, I saw on my Facebook post, someone said, Happy COVID Sunday. And I said to myself, they're actually naming their day COVID. That is, so that's just
But I like
confirms
your
what you're
analogy.
saying.
This is amazing, isn't it? How we are. But because see, for me, we have a law to wear the mask. So I'm not going to break the law. But what I'm saying is you need to educate people about the protocols of the mask, which nobody is paying attention, but my followers are paying attention. So there's a protocol, right?
there's a protocol, and
Yeah.
I'm not at all advising that anyone break the local laws.
Exactly.
What I am saying is that you have to use a certain amount of common sense.
Yeah.
And certainly I agree that there's a lot of misinformation,
Yes.
even from so-called experts.
That's right.
Yeah.
And the thing is, the coronavirus, the things that you would do to prevent it are not really any different than what you would do to prevent the flu. You wash your
Right.
hands, you don't touch your mucous membranes, you don't cough or sneeze on anyone.
There you go.
You don't shut down an economy for it.
Well,
You do educate people, you educate them, and you don't misinform the public. And I suspect that the information or the misinformation that's being disseminated, that there may or may not be agendas behind that, that are driving that.
But for me, see, what I'm also saying, look, if you have a precondition, please stay home. If you don't want to go out, don't go out. But if you want to go out, wear a mask, please wear a mask. But what I'm saying is the economy has to keep going. The second lockdown is costing me a lot, myself, you know. I told you guys, remember
Yes.
that investor we had?
Yes.
Bonnie is one of us, was helping me with finding the land, everything in Lancaster.
Yes.
And so not only me, there are many people who care for the country, and we worked so hard to get this investor in the US. And the second lockdown is like people are like, oh, we can't trust California
They don't
people.
wanna come.
Yes.
Yeah.
So what we're
Stigma.
doing
It's a
here, I
stigma.
don't know, but all I know is I'm posting a lot of stuff what I'm eating, because somebody should have COVID is me. Because first thing, I'm only 105 pounds. Secondly, I'm 65 years young. And thirdly, my immune system is very low. I should be having COVID right now. But the immune system, as you said, vary from day to day, from moment to moment. If I don't have a good night's sleep, if I speak a lot and I have a lot of lights on the stage, I can get laryngitis. So I know that. So what I do, I come back and I take half a cup of garlic with a balsamic vinegar, whatever. I'm done, finished. You see? But I don't go and hunt for antibiotics. I don't go hunt for anything. I know a lot about Ayurvedic. I know a lot about Chinese medicine. I know about Indian medicine. I rather go there than go anywhere else. I've lived my whole life.
Well, one of the things I'm seeing is that when people are calling emergency rooms, because a lot of the emergency rooms are worried about being overrun with patients, many times they're advising people just to stay home, quarantine themselves, and call the ER when they're bad enough to be admitted to the hospital.
Right.
And that is precisely the worst advice to give to anyone, because by the time you're sick enough that you have to go to the hospital, all the tissue damage has happened and it's too late.
Yes.
You need to be very aggressive. If you see any symptoms, seek treatment right away, and do everything you can to maximize your immune system, and don't wait. Don't put yourself in a hole and wait until it's too late. Because once you get on a ventilator, once you're in a hospital, many times there's too much damage has already been done, and many people will not get off the ventilator.
Yes.
Well, thank you. Ms. Bonzzie, would you like to say something about the mask?
I have a question. If individuals are in Texas right now and you say they're in public and they're not wearing a mask, has there been an increase in COVID cases in Texas that you know of?
Well, it depends on which TV station you listen to.
Okay.
So,
Well,
the way that data is reported it will vary from state to state, from TV station to TV station.
right,
Yeah.
okay.
But I have only 17 doctors and 9 nurses. If somebody should know the business, I should know the business, right? Because I'm getting daily things what's going on. Anyway, I've been sharing a lot with you. What we are saying is not to disobey the law, but we are saying the people need to be educated about the protocol of this mask. You can't wear the mask 8 hours straight at work. You can't do that. So every half an hour, go out there, take it out. I have breathing exercises, 3 minutes, come back, refresh.
Yes.
Because nobody is gonna do for you. And we are in the public sector. We're just normal public people that cares for public health. So we are here as a global peace leaders, doing our job, educating people. We're not politicians. We're not religious leaders. And stay tuned. I will talk to you and I will introduce you about this gentleman, Mr. King, Dr. King, about how he sustained himself. He's also a full-fledged entertainment lawyer. So stay tuned for Art for Peace of our channel. For our hearts to your hearts, love and peace.
Love and peace.
We are one.
God bless.
God bless. Thank you.